Well, hi everybody. My name is Neil Seidman, and I'm co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And welcome to this webinar, Health Anxiety, What is it and how you can overcome it. So these webinars are presented by the Anxiety and Depression Association of America, which is the leading nonprofit organization in the field of anxiety and depression. And, our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, through practice and research. So I want to invite everybody, really take advantage of all the free resources on our website. That's adaa.org. And also on our website, you'll find a really wonderful list of treatment providers. You just click on Find a Therapist right from the homepage. And we also have a free peer-to-peer online support group. And then finally, you can support our organization by making a charitable donation also on the website. Okay, so let's get started. Now keep in mind, we're gonna, for our live audience, we're gonna have a Q&A period at the end of the webinar. So during the webinar, you might wanna write down a question, and then when we get to the Q&A, I'll explain how to type it in. So I'm really happy to introduce our presenter. Ken Goodman is a licensed clinical social worker. He specializes in the treatment of anxiety disorders and OCD. He's a member of the board of directors of ADAA, and he's also the founding director of quietmindsolutions.com. Ken has authored and produced a 12-hour self-help audio program for anxiety sufferers, and the title is the Anxiety Solution Series, Your Guide to Overcoming Panic, Worry, Compulsions, and Fear. And he also created a coloring self-help book called Break Free from Anxiety. And lectures at universities and organizations around the country. And in his private practice in Los Angeles, it's individual and group therapy to help anxiety sufferers free themselves from debilitating fear. And Ken's website is kengoodmantherapy.com. So let me turn it over now to Ken.
Well, hello, everybody. Bringing up my PowerPoint. Just want to make sure everyone can see that.
Yeah, looks good, Ken.
You can see it? Okay, great.
Yeah, looks great.
Thank you, everyone, for joining us today. I just want to start off with a quick story. Many months ago, I had a patient with health anxiety, and she had a fear of having a brain tumor, so she went to her doctor. She went and had an MRI. And as she waited for the results, of course, she was extremely anxious and nervous and went to her doctor to find out the results. The doctor told her everything was negative. You have no issues. There's no brain tumor. Everything was fine. You have no reason to be worried, but if you're concerned, come back in 6 months. So, of course, she was relieved. So she went home very happy. But that night, as she was lying in bed, she started to think to herself, why would she tell me to come back in 6 months if there was nothing wrong? She picked out one piece of what her doctor said, and that cycled out of control and started another round of worrying. So even though the MRI was negative, she still wound up becoming very, very anxious. And that is why health anxiety is very tricky. We're going to talk about the other tricky aspects of this disorder. What is health anxiety, and what are the strategies you can implement to overcome it? And we have a special guest today. We invited Stephanie on. Stephanie is a former health anxiety sufferer, and she is going to chime in throughout this talk that I'm giving and share from her perspective, from the patient's perspective, what it took to overcome this disorder. So, Stephanie, welcome.
Welcome, Stephanie. Thanks for joining us.
Yeah, thank you. I'm happy to be here.
So there is actually no official diagnosis called health anxiety. There's actually two diagnoses in the DSM, the Diagnostic Statistical Manual. It's illness anxiety and somatic symptom disorder. The primary distinction between the two is the presence of somatic symptoms that are distressing or significantly disrupt your life. So, such
Now,
as
when you say somatic, Ken, are you talking about physical symptoms in the body?
Yeah, physical symptoms. So pain, neurological stuff like weakness or lightheadedness, digestive symptoms such as diarrhea, cramping, any sort of like acid reflux or chest pressure that you might feel, racing heart. So these are all somatic symptoms. Whereas illness anxiety, you might not have so much of that. It's just more of the worry. But for our purposes here, we're just going to lump them all together. So we're not going to make a distinction between the two. And I'm going to talk about the characteristics of, I'm just going to call it health anxiety, which are going to encompass both of them. By the way, we're going to try to get through as much as we can in this PowerPoint. If we can't get through the whole thing, we'll have a part 2. So we'll get to everything. Okay, so there is a preoccupation with having or acquiring a serious illness. So when I mean having, like you actually believe that you have some sort of serious illness, or there's a fear that you're going to acquire, that it's going to happen someday, possibly imminent, possibly in the near future. There are somatic symptoms that I just talked about that are distressing and disruptive, and that includes so many different things that we'll get to, including tingling sensations in the hands, lightheadedness, lump in the throat, all sorts of difficulty breathing, all sorts of physical symptoms, as well as an excessive amount of time devoted to those symptoms and health worries. So a lot of what if thinking, imagining worst case scenarios, preoccupation with your symptoms and your worries. There's a lot of time devoted to it. And then there's a lot of behaviors related to that. So regular visits to the doctor, medical tests, maybe taking too much medicine, or a lot of reassurance seeking. So you go to your spouse and you say, hey, I have this feeling here. What do you think it is? So you're getting reassurance, maybe scanning your body, looking for things. And then there's a lot of compulsive checking. So I have a patient currently who have fear of his blood pressure being too high. So there's people can take their blood pressure throughout the whole day, just checking it over and over and over. And then there's also searching online, going on WebMD, so putting in their symptoms and seeing what comes up and rereading the same articles. So there's a lot of behaviors related to this disorder. And finally, avoidance, fear of going to the doctor. Some people go to the doctor too much, and other people avoid the doctor completely because they don't want the bad news. Maybe they avoid trying medicines because they're afraid of side effects. Maybe they feel physical symptoms, so they don't want to leave the house. They don't want to exercise. They don't want to watch certain things because they're afraid they might see something that might trigger their anxiety. So these are the primary characteristics of health anxiety.
So Ken, can I jump in there for a sec?
Yeah, sure.
Just because as you're going through it, it's so funny because it really reads as a textbook. I'm kind of laughing to myself as you're going through it in a way of like, yep, it's as if you've been watching me over the years, but all of that, you talked about the blood pressure, but I think about like laying there and holding my pulse and checking my heart. And like, the doctor saying to me one time, I had gotten my heart checked and he said, no, everything looks great, but I can't guarantee anything with a heart. And I thought, oh, it completely threw me. So all of these things, the searching online, when I would go to an article, it would say last visited and then the date. And I think, oh, I've read this one already, but you're reading it again and again. So all of these things are right on. It's actually, it actually is nice to know that this is a real thing, because I think when we're in it, we feel like we're the only one feeling this, but you've just explained it perfectly.
Yeah, by the way, for our audience, Stephanie was not my patient. She was a colleague of mine's patient. So we're actually meeting, we just met for the first time a couple weeks ago. So I'm glad you shared that. Yeah, this is what health anxiety is. And unfortunately, sometimes people they have a hard time believing that actually what they're having is a psychiatric illness. They firmly believe that what they're experiencing is a medical illness. And when you've been medically ruled out for everything, what's left is really health anxiety. So what underlies all anxiety? It doesn't matter what your anxiety is, whether it's public speaking or fear of going in closed spaces or spiders or fear of driving or social anxiety or health anxiety. There's two things that underlie all anxiety. These are the roots of anxiety, so we'll talk about these a lot. And the first one is an intolerance of uncertainty. You can't tolerate a certain set of uncertain situations. And for health anxiety, it's uncertain. Like, what is this mole? What is it? I don't know, I'm uncertain. And the other one is an intolerance of distress. Like, you feel that distress and you can't tolerate that either. So those are the hallmarks of all anxiety disorders, no matter what you have, and OCD. So what causes the fear of illness? Well, it's similar to what caused anxiety in everybody. Genetics play a huge role. Genes that are passed down from one generation to the next. Also, just living with an anxious parent who is anxious about illness can create anxiety. I mean, if you have a parent and you grew up with a parent who is constantly worrying about their own illness, you may pick up on a lot of those worries and assume them for yourself. Maybe you had a loved one who suffered with an illness and you saw everything that person went through, and now you're worried that you might experience the same thing. Also, maybe someone died of an illness and now you're afraid of acquiring that illness. Maybe you've suffered from an illness before and you know what that's like, and now you're worried about having a relapse of that same one, or maybe a different one. And then finally, maybe a doctor missed something. And so now you don't even trust doctors because they missed something critical. And now you're worried that you can't just trust anything the doctors say. So worry about health is easily triggered. And these are the most common things that trigger worries about health. An unusual or painful sensation in the body. So anything that comes up that's unusual. And in fact, it doesn't even have to be unusual. It could be the same thing each time, so things that just come up randomly, the new stuff, but old stuff that you've been suffering with for years can trigger it as well. A flare-up of a medical disorder. So for instance, if you have acid reflux and you eat something that probably triggers acid reflux, and now you experience the acid reflux, now you start worrying, wait, is that acid reflux or is that esophageal cancer? Is that throat cancer? Something about burning in my heart. Is that heart issue or is that some sort of GERD or heartburn? We don't know, it's uncertain. Social media posts. You're coming across something in social media about someone diagnosed with MS, and now you're worried about MS. Maybe you're watching television or a movie or see something on the news. There's a scare about bird flu that you see. Now you're worried about getting bird flu. Hearing just someone talking about it. You're at a party and someone talks about someone else who had some disorder, some disease they acquired, and now you're worried about you're going to get it. Or maybe something that your doctor says. Stephanie just brought up something. Doctors will commonly say, well, nothing, everything's fine right now. So you just focus on the words right now. Oh, well, but what about later? Discharge instructions. A patient of mine just showed me his discharge instructions. I'm going to read one to you. He has a little bit of high blood pressure, primarily because of anxiety. And so the doctor gave him these discharge instructions, and this one line triggered him. The risk of complications from uncontrolled blood pressure indicates infection, nerve, heart, brain, kidney, and eye damage, which may not be reversible. So, just the discharge instructions can scare people. And finally, lab values outside the normal range. So your blood pressure might be a little high, or your cholesterol might be a little off. And that just can really trigger it.
Stephanie, can you relate to any of these?
Finally, one more, sorry. Waiting for test results. So you just had a test and I got to wait a week for results. Were you going to ask Stephanie something?
Yeah, can you relate to some of these, Stephanie?
Yeah, I'm just like with every point, I'm just remembering different things. You mentioned the lab values. I remember looking at my white blood count, and I called my doctor and I was like, why is that low? And she's like, no, Stephanie, you look at the whole picture. You look at, it's not just the one. I'm like, yeah, but of course then I'm online looking up why that one white, what does that one mean? The discharge instructions, it's always like, and after times that I have visited the emergency room, because I was sure, that I was either having a heart attack or I was having something, and then you look at the discharge and all of that. And I think as a health anxiety sufferer, when you go to the doctor, you definitely hear differently than the average patient would hear. You're just more aware of all the fine little things that they say. So absolutely, yeah.
Yeah, it's really easy to.
And the unusual, the painful sensations in your body. You're describing GERD. Anything.
Is that what you
mentioned
GERD?
mole. Yep, I've dealt with. Yeah, I've dealt with that for years. So that causes all sorts of things, But then you mentioned having a mole, and I've gone down that path. Numbness. I've gone down that path. I've had every disease you could possibly have without ever having any disease. Fortunately.
Mm-hmm.
So yeah. So it's all right on.
Yeah. Okay. So once you're triggered, lots of different things might happen from there. One, you might start avoiding, like, I'm feeling something in my heart, I'm not going to exercise. Maybe I'm not going to go out. Maybe I'm not going to, I don't want to see people, because if I see people, they might talk about some disease. I may avoid going to the doctor. There's also dwelling and worrying. So once you're triggered, you start thinking about it over and over and over. So you just can't get out of your head. There's compulsive checking. So like you mentioned, you go online, maybe you start scanning, maybe you just check your pulse. And then you can just get reassurance, and you're just constantly asking people for reassurance. You're calling your doctor, you're emailing your doctor, you're talking to your spouse, you're getting tests. And then finally, once you're triggered, you can experience physical symptoms. We're going to talk about this right now, why physical symptoms are triggered once you have something that just sort of just pops out at you. So here's how this works. Everyone's heard of adrenaline, right? There's a nickname for adrenaline. Do you know the nickname for adrenaline? They call it the fight or flight hormone, right? Because adrenaline is for emergencies. It's a necessary and really important hormone. It makes you fast and strong so you can run from the danger or fight the danger. So for instance, if a fire breaks out in your house, your brain will send signals to the adrenal glands. The adrenal glands will secrete adrenaline. That'll make you fast and strong so you can run from the fire or put it out. Oh, you can hear my phone ringing. That is fantastic, but that'll go away. Now, adrenaline is a necessary and important hormone. However, adrenaline also causes lots of physical symptoms of anxiety. Tons of physical symptoms, like racing heart, rapid pulse, tightness in your chest, difficulty breathing, lightheadedness, sweating, muscle tension. So many physical symptoms are caused by adrenaline, and these physical symptoms are also symptoms of medical illnesses. So it makes it very tricky, very, very tricky. So you can feel like a tightness in your throat. Well, what's that? Well, remember, adrenaline can cause muscle tension throughout anywhere in your body, anywhere from here into your chest, down into your abdomen. So it causes so many physical symptoms, and people can easily get fooled. But it's very predictable. It's like other physical, it's like other substances. So what would happen if someone drank, what would happen if someone drank too much coffee? What would happen? Anyone? Anyone? Bueller? No. You would get shaky and jittery, right? Shaky and jittery. And what would happen if someone drank too much alcohol? Well, you would start slurring your speech, feeling off balance, right? It's predictable. It's the same thing with adrenaline. You're just not drinking it. It's happening internally. It's because your brain is sending signals to the adrenal glands, right? Now, the brain's amazing, calculates thousands of things at the same time, but it tends to do what it's programmed to do. So it's a bit like a computer. What would happen if someone reprogrammed your computer? 2 + 2 = 5. Well, next time you push 2 + 2, it would equal 5, even though it's wrong. Well, it's the same thing with your imagination and your brain. If your imagination tells your brain something scary, your brain is going to send signals to the adrenal glands to secrete adrenaline, and then you're going to start to maybe have jitters. And then once you have jitters, you're going to be, oh, now for sure I have ALS. I can feel my jitters, right? So here's the flow. Imagination says something scary. There's something wrong with your heart. Your brain signals the adrenal glands secrete adrenaline, and now your heart's racing. Now you can have the physical symptoms first, like suddenly you start to feel some heart racing, and then you have the thought after. So the physical symptom can come first, or the thought can come first.
But in both cases, it's stimulating the fight or flight and the adrenaline, which is then leading to maybe a whole bunch of different bodily somatic sensations.
Yeah, it just reinforces what you're already thinking. You know, for someone who has a heart worry, it's going to make your heart race, which is going to make you believe that you're having a heart issue, right? So you could be having a great day. You're just on the computer doing your social media, and then you read something on Facebook about someone who is diagnosed with MS, and suddenly you're spin out of control. And so it's so easy just to flip just when you get just the right trigger. Now, why does this anxiety reaction happen so quickly? Why do rational people somehow become irrational? You might kind of wonder, like, I'm a rational person. Why does this happen so much? Well, it comes down to two parts of the brain I'm going to highlight. The first part is the prefrontal cortex, which is in charge of logical thinking and reasoning. Right up here. The other part is the amygdala, which is a small almond-shaped, kind of the mid part of the brain, which has to do with emotional reactions. They call it the primitive brain. Think of a lizard. If you would just kind of clap real loud, the lizard would jump, right? It just reacts. And that's kind of what happens with humans as well. The amygdala processes information way faster than the prefrontal cortex, so much so that it hijacks the entire brain, so you can't even think clearly. So any rational thinking that you would possibly be able to do, when your amygdala fires off and you start to feel those physical symptoms, it's hard to think logically. Think of you put a piece of toast in, something in your toaster oven, and you leave it there and it starts to burn and smoke starts to come up. And if you happen to have a smoke detector in your kitchen, it's going to go off. Smoke alarms don't have a frontal cortex to determine if the smoke is really a sign of danger. It just is triggered and it just sounds off, fire, fire, which basically is what happens when people have health anxiety, or all forms of anxiety, actually. So the brain is made up of billions of neurons connected to one another, a complex network. Think of billions of telephone wires crisscrossing through your brain. They used to think that the brain never changed, and now we know that it does change, and it changes when there's a highly emotional event, whether it's good or bad, as well as repetition. So just like repetition, repetitive lifting will strengthen your muscles, repetitive behaviors change and strengthen the neuronal connections in your brain. So for instance, typing, when you're first learning how to type, you have to really think about where your fingers are. But if you practice every day for a half hour, pretty quickly you begin to just do it just automatically. It's just automatic. And what's happening in your brain is those neuronal connections have changed, and they become stronger the more you do it. So much so that if you stop typing for 2 years, you can come back to it. The connections are still there, and you can still type. Now, if they rearrange the keyboard, you'd have to start all over again and learn the new keyboard, and then the neuronal connections in your brain would change again. So with all the practice you've had in avoiding and worrying and compulsively checking and scanning and seeking reassurance and focusing on your symptoms, you have strengthened the neuronal connections in your brain and exacerbated your anxiety about illness and death. You are an anxiety expert with all the practice. And that's basically what happens when people have all sorts of anxiety. So here's the question. How do you conquer health anxiety when you are genetically predisposed? You have had years of practice at worrying, avoiding, compulsing, and seeking reassurance, which has strengthened the wiring in your brain to be anxious and train your amygdala to seize control of the entire brain so you can't think rationally. In other words, how do you fix the faulty wiring in your brain? Well, I do have some good news. You don't need brain surgery. You just need cognitive behavioral therapy, CBT, which is what we're going to talk about now. And if you seek therapy from someone for this disorder, you need to make sure that they are highly trained in CBT. Cognitive behavioral therapy, cognitive part has to do with your cognitions, the way you think, changing the way you think, and the behavioral part is changing the way you behave, your behavior. So we'll get into that.
How did you find good help, Stephanie, in your process?
I'm sorry, what was the first part you said?
How did you find good help for yourself?
How did I find good help? In the very beginning, I did a lot of research. In fact, the person I worked with most recently, I had read a book that I loved. And so I actually called the author of the book because I thought I loved everything the author said. So I called him, and he couldn't help me, but he then put me in that direction. And I think it is really important to find, you've got to talk to people and make sure that, like Ken said, that they're really qualified and they really understand that specific anxiety that you're dealing with.
Yeah, you can easily tell by their website. If you just go on the person's website, if they primarily talk about anxiety or OCD, you can tell that, all right, that's what their specialty is. If they talk about doing marriage counseling and self-esteem building and all that stuff, depression, and then, they kind of are a generalist and they treat everything.
Well, I think that's kind of the struggle too. I was going to say, I think that's kind of the struggle too with when you're looking for a therapist, especially if you're looking for someone under your health insurance. You get these long lists of a lot of therapists who have, 25 different specialties. But I do think there's therapists out there who just list everything, because you covered everything in school. So I do think it's important, like Ken said, to go to their direct website, and actually have the conversation with them. And you know what? Sometimes you'll go to a therapist and it won't really work. They won't really have what you're looking for, and that's okay. You just got to keep going.
And with, sometimes hard to find someone in your area, but with video conferencing, you can often find someone in your state who specializes in it. And you would just do video conferencing, which is really helpful.
Yeah, and I would encourage people to be open to that, because I think that, I think the traditional therapy is in the office, but I think it's great that we have that we can do it via Zoom and via all these different avenues, because then you can get the best treatment.
Yeah, ADAA actually has a list of therapists who do video conferencing on the website. Okay, so our bodies are naturally noisy, all sorts of things. I mean, this is natural. And I think sometimes when you have health anxiety, you expect there to be no noise, but that's unrealistic. This is just a partial list of the things that can happen on a regular basis. And if you have anxiety, you are going to experience more physical symptoms because of adrenaline, because you're constantly worrying about things, which is signaling the adrenal gland and the amygdala. And so you're going to feel more, your body's going to be noisier than the average person, even if you're in perfectly good health. But if you're in perfectly good health, you're still going to have a noisy body. I mean, just the other day, I was feeling something like a little muscle twitch. It was like right here, right there, just a muscle twitch. And it kind of went on for a little bit, but then it went away. And the world is a noisy place. So we talked about these things, news about health scares, Facebook posts, friends that talk about relatives that have had diseases. So the world is a noisy place. Your body's a noisy place. It's easily triggered. And anxiety is filled with inner struggle and inner turmoil. Should I go to the doctor? Is this a new mole? Does it look different than the old ones? Why is my blood pressure so high? Should I take it again? Maybe the doctor missed something. Maybe it's not acid reflux. Maybe my cholesterol is not in the normal range. Should I be concerned? So there's constant inner struggle and inner turmoil when you have health anxiety. And I want you to start looking at anxiety from a different point of view. The problem that people have with anxiety is they're trying to solve the problem of anxiety from the same perspective that created the problem. Let's shift your point of view so you can look at the problem in a different way. And the way I want you to look at it is, instead of struggling with anxiety, look at it from the perspective of a mental game against a very clever opponent. It's a mental game against a very clever opponent. And you win this game by freeing yourself from health anxiety. But your opponent has a different objective. He wins by keeping you trapped. So your opponent has a strategy, which is why he's winning, and you don't have any strategy. So what we're going to do in this webinar is talk about what your opponent's strategy is and what your strategy needs to be. So your opponent has a few strategic moves, only a few, but they are really good ones. The first one is he lies. He lies, he exaggerates, he catastrophizes, he tells you half-truths. If something has a 1 in 1 million chance of happening, he'll tell you that it's likely. He makes you focus on things that are unimportant, but if you believe it, it's going to feel true. Like, for instance, Stephanie, you were saying that you had all these worries about different diseases and disorders. Do you have any of those diseases or disorders?
No.
How long have you had health anxiety for?
Probably been about 7 or 8 years. I think it started about, maybe 9 years ago. 9 years ago. It started.
9 years ago. Okay. So over 9 years, on a daily basis, or not a daily, but regular basis, lie after lie after lie, and none of them were true.
None.
Yeah.
No.
Okay. That's a very common thing. The other one is to engage you in a conversation, so you focus. So your focus and attention is on health and the symptoms rather than living your life. So the first one is to lie. The second one is to engage you in a conversation. And the third is to trick you into doing what he wants you to do. Scan, check, ask for reassurance, visit the doctor, avoid the doctor, go online, right? So this is the strategy of your opponent, right? Now, your opponent has lots of rules, and these are many of them. He says you must be 100% certain. Not 99%, you have to be 100% certain that you don't have a disorder, or you won't get one. You can never believe your doctor or test results. You just can't trust them. If something bad happened to someone else, you must believe the chances are high that it'll happen to you. If something feels dangerous, then you must believe that it is dangerous. You must take scary thoughts seriously to protect yourself. You must believe that the worst possible outcome is the most likely outcome. You must scan your body all day long for signs of illness. You must focus on symptoms to make sure they don't get worse. You must focus on your health to make sure you don't die. You must contemplate all of my questions and search the internet for answers. You must do everything I say. And if you follow these rules, your monster wins. Can you identify with any of these rules, Stephanie?
Absolutely. I'm going through them. Yep. Yeah. And it's really hard, but that's the only way to do it. And I think that's the only thing that's gotten me past is not following these rules. And you actually have to, I notice them coming in. I notice the voice telling me the rule. I know the rule, and I have to just say, nope, not today.
Mm-hmm. Right.
If I could just break in just for a moment, because we're getting some questions of people that want to be able to spend more time with some of these wonderful slides. I just want to let everybody know that the webinar is being recorded. And so you'll be able to watch it again at your leisure through the ADAA website. And we will check in to see if there's some way of making the actual slides available, but definitely you'll be able to go through this webinar again at your leisure.
Yeah.
Some of these
Now,
slides
what
are so
helps?
wonderful to be able to pause and read over again.
Yeah, absolutely. Now, one of the things that I talk to my patients about is to really take this idea of playing a mental game and put it into practice. We do that by externalizing anxiety and personifying it. So we take the struggle out of you and then we personify anxiety. We give it a face and a form. And now we're saying, okay, I'm playing a mental game against that guy, right? So if I create some sort of a creature and say, okay, that's going to be my anxiety or anxiety monster or my opponent, however you want to call him, and he's the one who's going to be telling me all these things. It can be so much easier to look at your problem when you're doing it in that way. So rather than I'm having a headache, what does that mean? It's, it's why do you keep getting headaches? It's not why do I keep getting headaches? It's why do you keep getting headaches? What if you have brain cancer? Go search online again. Like he's telling you to do these things, right? Your doctor is very busy. What if she missed something or made a mistake? WebMD says you might have MS. You have all the symptoms, right? So your anxiety disorder, your opponent is basically dismissing the fact that your doctor spent the last, 8 years in medical school and suddenly gives WebMD the credit that it deserves. You have to diagnose yourself. You are actually the best judge. You are the doctor. Forget your doctor. Your doctor can make mistakes, right? So you're devaluing your doctor. Why do your hands always tingle and shake? Is it ALS? Hold out your hands and see if they shake, right? So he's telling you what to do, right? And if you do it, you're making him stronger. You're feeding your anxiety by engaging in what he tells you to do. Why does your heart race like that? Take your blood pressure again, right? Again, you're taking your blood pressure, you're feeding your anxiety, you're making it worse by doing it. You think you're making it better because you want to get that comfort, you want to get that good reading, but in actuality, you're just making the anxiety worse. Ask your wife what she thinks. Now you got to ask your wife, what do you think? You think I have a problem? And then it can cause marital trouble. What does your stomach still hurt? What if you have a stomach ache? Cancel your plans with your friends. Just rest and see if it goes away. Again, he's trying to get you not to do life. He wants you to focus on your stomach. Stay home, focus on your stomach. Don't go out with your friends, right? The goal of your anxiety is to make sure that you're miserable. So let's talk about what your strategy needs to be. These are what I'm going to put up now are the things that you have to implement. And these things are, like everything else, easier said than done. But this is what your strategy needs to be. And we'll go into them more specifically, but here they are. So the first is you have to refuse to believe your opponent's lies. You have health anxiety. let this be your default. You already know you have health anxiety, or at least you should know you have health anxiety. That should be your default. Remember, you have that too. It doesn't mean you can't have medical issues, but don't devalue or minimize the health anxiety that you have. Live without absolute certainty. Be certain enough. To be free from anxiety, you can't be certain. Now, I went on a plane last month. There was no certainty that plane was going to land, but I was certain enough. I didn't go into the cockpit and ask the pilot for his driver's license, or I didn't test his breath to see if he had been drinking. You know, I'm just going to trust that he knows what he's doing. I'm certain enough. You can't be 100% certain. If you demand 100% certainty, you have to have health anxiety. So you have a choice. You can have health anxiety, or you can be certain enough. The only way to be free from anxiety is to be uncertain. Do not fall for his tricks to engage you in a conversation. Don't answer the question. Respond shrewdly. We're going to talk about how to respond when you have an anxious thought. But anxiety is trying to bait you into a conversation. If he can get you into a conversation, think about a fisherman. He throws out the line, he's got the hook, he's got the bait. The fish takes the bait, he's caught in the struggle. So that's what happens when he asks you a question. What's that thing right there? Why are you feeling so much pain? And then suddenly, for the next half hour, you're focusing on the pain. Do the opposite of what your opponent tells you to do. Super difficult, very hard, and yet critical to overcoming this disorder. And lastly, focus on living your life and not on your health. The goal is to live your life. It's not to be comfortable or certain. Any of these things, Stephanie, ring true for you in your journey towards?
Yeah, a big one for me was practicing to do the opposite. In fact, the thought would come up about something, and I would, just being aware that the thought came up was really helpful to me, because then I would know what it was. This is just your health anxiety, and I know that I'd have to do the opposite, because I know that that's really the only path there. I think you said it in the beginning that these are all easier said than done, and they are. And I think that's one of the hardest parts about health anxiety, or any sort of anxiety for that matter, is that, yeah, these are all really great. These are great strategies. They're really, really hard. But at the same time, they really work. Like, if you can really practice them and have the goal in mind of living your life, they're really helpful.
Yeah.
But it's easy to fall into the tricks of and I do think of that. I do think of my health anxiety as something separate from myself. I do think of it as, oh, there's my health anxiety again. Oh, there's the story that I'm having a heart attack again, or there's that story. Really separating it out is helpful. So
accept what you know for sure, and let this be your default, right? For the sake of time, I'm gonna just go on from this, but just know that, all right, I have health anxiety. I know that for sure. This other stuff I'm uncertain about, I don't know. So if something comes up, remember, okay, I have health anxiety. This is what I have. Right? Don't minimize that. It's significant. I mean, Stephanie, you suffered with it for many, many years. That's a significant amount of time, and probably I have listeners who probably been suffering for longer. This is a real disorder. So remember, you have that. Don't minimize the psychiatric component to this. And to be free from anxiety, you must be uncertain. So whether it's a plane, or you're going into the ocean, or you're walking across a tall bridge, or you're going into an elevator, it requires you to live a life of uncertainty. When you go on a trip to Europe and you bring your passport, well, you could lose it. You could be bitten by a dog. There could be a terrorist in a mall. I mean, your house could burn down when you leave. I mean, there's all sorts of things that can happen, but you live an uncertain life in order to be happy. You can't be certain. So what you focus on will grow. So think if you wanted to plant a garden, and if you go plant a garden, you go get the seeds, you get all the tools, you find the perfect place in your backyard. You know, you tend the soil, you feed it with whatever it needs to feed it with, you put the seeds out, you put some contraptions all around, you build the cages so the rodents won't come in, water it, pick out weeds, it's going to grow. If you tend to it, it's going to grow. If you don't do anything but just throw the seeds in the ground, it's going to die, right? So the more you focus on something, the more it grows. And it's the same thing with your thoughts and your behaviors. The more you do it, the more you focus on it, the more the anxiety gets worse, which is why you have to stop doing those behaviors, do the opposite of what anxiety tells you to do, and not engage with those questions. There's obsessions, which are thoughts and worries, and there's compulsions, which are behaviors. Primarily they're behaviors. They can be, there's such thing as mental compulsions like praying or reassuring yourself over and over and over. But think of the obsessions or the thoughts and the worries. If you want those thoughts and worries to go away, if you don't want to have worries about health, you have to stop the behavior first. You can't stop and eliminate those worries unless you stop the behaviors first. It doesn't go in the other direction. So one of the first things you said that was helpful was doing the opposite, Stephanie, of what your anxiety told you, which was huge. You can't stop those health worries unless you stop your behaviors first. So what are those behaviors? Stop reading WebMD, stop scanning your body for symptoms, stop checking your pulse and the other symptoms, stop asking loved ones for reassurance, stop going to the doctor unless there's really a problem, and that can be kind of tricky. Stop avoiding triggers, go to the doctor if you avoid going to the doctor, exercise and eat healthy for the right reasons, right? So you have to change your behavior if you want to change the way you think.
So this is a good slide for people to come back to when they're watching the recording, that list of behaviors to change to really start implementing this new strategy to start overcoming the health anxiety.
Exactly.
Wonderful slide.
So your behaviors are exacerbating your health and anxiety and making it worse. Not too long ago, I was driving, a bird turd landed on my windshield. It wasn't that big, but it was like, you know, I kept focusing on it, kept looking at it. Now I could have looked past it and just looked at the road, but I kept looking back at that bird turd and I wanted to get rid of it. So I turned on the windshield wipers and it made it worse. So sometimes your behaviors make things worse. If I would have just left it there and looked past it, it would have been fine. But somehow people notice a symptom and they keep focusing on it. And by focusing on it and doing other behaviors, they make it worse. So focus on where you have control and learn how to respond and not react. You know, when you go out in the rain, you take your umbrella. You're not trying to stop the rain. You would be foolish to try to stop the rain. You have to respond to it and deal with the rain and not try to stop the rain. So you're going to have those anxious symptoms. We're not trying to stop those anxious symptoms. What you're trying to do is learn how to respond better to them, right? So respond with something your opponent does not expect and focus on living your life. Give you some examples. Here are responses for worrisome thoughts. So if your anxiety, your opponent says to you, what if you really do have cancer? There's lots of different ways you could respond to that. I'm not answering the question. Thanks for sharing. Have a nice day. I'm certain enough and I'm living my life. I'm not falling for your crap. I'm excited to be free. Oh, excuse me. I'm excited to be uncertain and free. Moving on. And there's other responses too. F off, and you know, there's lots of things you can say. But what you don't want to do is engage with the thought. You have to have a quick response that anxiety doesn't expect and then move on. So like Stephanie, when you would have an anxious thought, how would you respond to it? What would you do? Are you there?
Yeah,
Stephanie?
yeah, I'm here. It just got a little funky for a second. What was the question?
Oh, sorry. When you would get an anxious thought, or when you get an anxious thought nowadays, how do you respond to it? Like, is there
Yeah, so
something
I
that you
think in the
say?
past I used to, just answer it immediately. But I think now when that happens, or I know that now that when that happens, I kind of notice it and be like, yeah, thanks. Thanks. I just thank it. Move on.
Okay, there you go. Thanks for
Thanks for
sharing. Have a
checking
nice day.
in.
That's a
Yeah,
very
yeah,
different
thanks.
response from, I better make sure that I don't have whatever the illness is.
Right? You can't engage with
Yeah,
it.
and I think that's where and as soon as you go to Google, I feel like the amygdala is right on alert, the adrenaline, like it's you've lost the game. It's like,
Yeah.
I think that was my biggest thing, is that just makes everything worse, because you will have every disease when you look at Google. Absolutely.
Yeah, totally.
Every symptom. So
Now, when you get a
just can't
physical
engage.
symptom, when you get a
That
physical
too.
symptom, your responses can be different. Oh no, your heart is racing. Whatever, I can handle it. Welcome back. Stay as long as you like. Focusing on living, not my noisy body. Bring it on. Give me a heart attack. I dare you. Thanks for this opportunity to rewire my brain.
These are just wonderful examples, Ken, of different ways of responding.
Yeah, I had a patient who had a fear of having a heart attack. In a year, he probably went to the ER like 10 to 20 times. And he's learned how to respond back. And so when his heart would start to race, normally he would sit down and wonder why it was happening. And he got to the point where he was like, his heart would start to race. He would say, all right, come on, give me a heart attack. I dare you. Kill me right now. And then nothing would happen. And he would feel empowered, right? You're standing up to anxiety, standing up to it. So the physical symptoms are true. You're actually having those physical symptoms. The thoughts are lies and distortions. So you could handle a thought differently. You can say that's a lie. I'm not going to believe it. That's a bunch of crap. But you can't say that to a physical symptom, because you're actually having a physical symptom. So that's why I make a distinction.
Yeah.
So how do you get better at handling physical symptoms and anxious thoughts? With practice. What kind of practice? Well, if someone plays baseball and they're really good at fielding, but they're not so good at batting, what do you think they need to practice? Batting, right? They have to get up to the plate. They have to tell their pitcher, all right, throw me balls, throw me a curveball, throw me a fastball. I need practice. So that's what you're going to be doing with your opponent. Look at your physical symptoms and worrisome thoughts as opportunities to practice. Invite your opponent to try to trick you. Want what you don't want. Pitch it. Give me what you got. Try to trick me, right? And you're making the first move. You're stepping up to the plate and inviting him to try to trick you. He's going to try to do it anyways. You might as well invite him. So I usually advise my patients in the morning, say, all right, try to trick me. Let's go. Try to give me something. And at some point during the day, either something will occur to you, something will trigger you, or something not. Maybe nothing will happen. But you're making the first move in this mental game. Want what you don't want. That woman that shook your hand said she had food poisoning, but what if she really has neurovirus? Thanks for this opportunity to practice not answering the question. And then you're turning away and living your life. Go do stuff. Go live your life. Don't focus on the health stuff.
Yeah, I think Bring It On for me was a really big one. I'll feel it like in the middle of the night or something, it would wake me up, whether it was chest pains or whatever it was. And, you know, what it wanted me to do is it wanted me to sit up straight and go to the computer or call 911 or wake up somebody or do something. That's exactly what it wanted me to do. And over the years, I've just learned, I just lay there and I'm like, wow, this is kind of cool. Like, this is, you know, can you make it worse? Like, how bad's this gonna get? And then I almost surrender to it too. Like, there's a sense of confidence I have within myself that I'll know when I really need to do whatever it is that I need to do in an emergency situation. I just kind of, I try to relax into it, and I feel like that really helps. And then, you know, I also have this empirical data within myself.
Yeah, and I applied this strategy to myself not too long ago. I was getting these foot cramps. It would just come, I'd be lying in bed, I get a foot cramp, and then normally I would grab my foot and try to massage it. And then I said, you know, the next time it happens, I'm going to do something different. So I get a foot cramp and I'm like, all right, come on, make it worse. Bring it on. Give it to me. And I would just kind of have this kind of tough attitude. And then it would start to rise and then it would subside and go away.
Let's bring in some questions, so we have a little bit of time for people to type in some questions.
Let me just say this one last thing. The strategy that we're talking about is to get you through the anxiety, not to stop it. It will eventually stop, but that comes at the end. Think of it as an umbrella in the rain. You're using these tools to get you through it. Like an umbrella, you're using the umbrella to get you through the rain, not to stop the rain. That'll come later, right? So yeah, let's have some questions. And, you know, Stephanie, I'm curious for you, the improvement that you made, like where are you at now in terms of your, you know, health anxiety, and does it still get you sometimes, or how and also how long did the treatment take?
Well, I think it's important to remember that that it doesn't, for me, it doesn't just go away. I don't struggle the way I used to struggle because I don't respond to it the way I used to respond to it. It tries to sneak up on me. I still get physical ailments. I'm a really sensitive person, so I feel the physical parts. I just don't respond to them the way I used to. So that's really helpful. But there's also times that I might be a little more sensitive. Maybe I have a lot of stress at work, or life's just busy and I feel more overwhelmed. I might be a little bit more vulnerable, but it's just keep putting things into practice. I think. So
if you were to say on a scale of 1 to 10, before you started treatment, 10 being the worst, how bad was your health anxiety, and what it is now? If you could put numbers on it, what would you say?
Yeah, there was a time that it was pretty high. I was up in the 8 to 10 range on any given day. I definitely was dying. And now I'd say, you know, like today, I don't have any health anxiety. Not that my back doesn't hurt or things don't hurt, but I'm 1. I'm really low. Like I really, you know, and then there's days I might spike up to like a 3. And I can,
but it stays in that range, like from 1 to 3.
Yeah, I don't go up that high anymore.
Yeah.
Okay, well that's
let's, sorry to interrupt, but I want to get to some of our questions. For our live audience, if you're on a laptop, you can go to the control panel at the bottom right. There's a chat box that you can click on. If you're on a smartphone, you should see a chat link probably in the middle of the bottom of your screen. We have a couple questions already. Here's a really great one. We'll go over a little bit, just give a chance to have a few questions. Here's a mother of a young adult who has health anxiety, and she's asking, hey, where do I draw the line between being supportive of my adult child and enabling and maybe reinforcing the health anxiety, which I don't want to do, but I want to be supportive?
Right, that's a great question. So you enable, the most common things loved ones do to enable is provide reassurance. So, you know, when the loved one calls up and says, what do you think about this? What do you think about that? Or excuse me, the person with health anxiety, you know, reaches out, that you say, no, I think you're okay. You're fine. You're okay. you know, and it never seems to be enough. I mean, you're just constantly reassuring. And so probably a better response might be something like, it sounds like your health anxiety is really getting the best of you, or it sounds like your health anxiety is really high right now. So now you're refocusing them on that it's health anxiety. You're reframing it that it's health anxiety instead of providing reassurance.
So it's
So that's
supportive, but it's not attempting to take away the distress.
right, right.
Good. Oh, here's a question. If I have a choice between doing cognitive behavioral therapy, CBT, for my health anxiety, or EMDR, so a lot of therapists do something called EMDR, is there a preference? Which is going to help me more, or are they about the same?
So you want to do CBT. EMDR will be very helpful if you've had a trauma. So if you have any sort of a trauma, whether it's health related or not, the EMDR will be helpful. So if you've had panic attacks and you thought you were dying, you know, EMDR can be really helpful for that. If you had a health scare, or you even had a trauma that was unrelated to health, EMDR would be helpful. But ultimately, you want to do the CBT. But EMDR I use as an adjunct to CBT. So you may need both.
Okay. So here's an interesting question. I know someone who did get colon cancer, and they were ignoring their symptoms. And I was diagnosed with stage 1 colon cancer a few days later. But it's like I'm really focusing on, even though it's an actual condition, I have a lot of anxiety about it. How could the CBT help me with something like this, even though I'm getting the treatment I need for the medical condition? And I'm fortunate that it was caught early, but how do I deal with the anxiety about it?
Yeah. First, I'm so sorry you have this. You know, as anxiety sufferers, we are not immune, obviously, from getting something medical. So that could happen, right? Um, and just by you saying this, who knows? There might be other people listening who might feel worried now that you have it. But you know, this is just part of life, and people get stuff. Um, you know, the cognitive therapy that you could use in relation to what you're going through now, because now you actually have an illness that's been diagnosed, can still be useful, because it's so important to have a positive attitude about getting better. And if you are constantly worrying about different things, it's not going to be useful to, you know, helping you with your cancer. So I think in particular, now that you actually have the cancer, that's even another reason why you should go get help, just to help you deal with the worry of, you know, what you're dealing with on a daily basis.
Okay. Here's a question for Stephanie that came in.
Yeah.
The question is about your CBT experience. When you started doing the CBT, was it weekly? And about how many sessions did it take before you started to see some meaningful help for you?
Yeah. So, you know, it's funny. I read that question and I thought, wait a second. I've been dealing with this way longer than 8 years. So I apologize, Ken. But here was the thing, is that I had kind of a break in it, now that I remember, because now I'm remembering when I first saw someone for CBT back 20 years ago. And it was for, I was having heart attacks all the time. And it was very CBT, and it was the first time in therapy that it changed everything. I still remember my therapist's name. Like, so I probably was in therapy at that time for, 6 months that we were working together weekly and really practicing CBT exercises every day. And that carried me for a long time. And I think that therapy over the years now, I just come back and revisit it. Like I said, sometimes you're just more sensitive, and, but it's not a forever thing. It's a forever thing that I practice it because now it's part of who I am. It's part of, the way in which I respond. But I think it's just going in and learning the tools. So it's not that you have to be, I don't expect to have to be in therapy for the rest of my life for this. I know how to do it now. Sometimes I might need support, but I know how to do this.
Yeah,
Yeah, congratulations on overcoming, because it's a difficult disorder to overcome. It varies. People get better at varying degrees. So it depends on not just the severity and how long you've been suffering for and your circumstances, but also how quickly you pick up on the strategy and how quickly you implement it. So, I've had people who can implement it and pick it up really quickly, and other people, it takes them a while. So there's really no great answer. Some people can get better within, 3 or 4 months, and other people, it'll take them a few years.
We have a question about when will this be available on the ADAA website? And my answer is quite soon, maybe in a matter of days. Here's a question, Ken, and we might wind up with this question. We have a question about exposure. So if I want to start working on my health anxiety issue, what is an exposure and how do I start doing that? And can I do that on my own?
Yeah.
Any general thoughts on that?
So we did not finish this webinar, so we'll plan on doing a part 2. So we didn't get to the exposure section, so we'll get to it next time. But to answer your question briefly, yeah, you can certainly do exposures. For instance, I'll give you an example of a few of them, but it really depends on what your fears are. So for people who don't know, exposures are facing your fears. So if someone has a fear of elevators, they actually have to get in the elevator. So if you have a fear of cancer, it's not like you're going to get cancer, but you might expose yourself to cancer-related stories. So you might read about someone who has got cancer, or you might write your horror story, like you getting cancer, and reading it over and over. Or if you're afraid of getting your blood pressure taken, it might be you take your blood pressure, 5 times in a row. But I'm hesitant to even share all this stuff because it's really not just doing the exposure, it's how you do the exposure. So it's a little bit like, swinging a baseball bat, it's how you swing it. So the next webinar that we do, we'll talk about specifically the best ways to do exposure and not just going out and doing it, because you can kind of do it wrong. You want to do it slowly, and there's a certain mindset that you need to have.
And then maybe you could give us some examples, and that could be a part 2.
Yeah.
One more quick question. Any books that you recommend for health anxiety or websites, Ken?
Well, of course, the Anxiety and Depression Association of America. You can go on. I wonder if there are books on our website. I know there's books. There's self-help book section. I don't know if there are any self-help books specifically about health anxiety on the ADA website, but there might be. And if so, I would recommend those. But I don't have any in particular. Yeah, I don't have anything in particular, but that's a great question. So for the next webinar, I will do a little research. I will check it out, and I will bring you that answer.
Okay, great. Well, thanks everybody for watching. Thank you so much, Ken, and thank you, Stephanie, for wonderful contribution. And for everybody watching, please like it and share it. And if you have a question, either on our live audience or watching the recording, you can go ahead and email your question to webinars@adaa.org. So bye for now, and we'll see you at our next webinar.
All right, thank you.
Thanks again.
Bye-bye.